Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems, Better Care podcast. I'm here today with Dr. Efrat LaMandre. She's a pioneering family nurse practitioner, best-selling author, and founder of EG Healthcare and the New Method. She's renowned for empowering her patients to take charge of their health by addressing the root cause of their symptoms. Thank you for joining us today.
It's a pleasure to be here.
And, just to give our listeners some backstory, how did you get here, and what are you building right now?
I'm a nurse practitioner. I opened up a practice, a conventional medicine practice. It has now become one of the largest NPO practices in the country. We serve over 20,000 patients. But somewhere along there, right, so I'm taking care of patients and doing all the things, evidence-based medicine. Somewhere along there, my wife got sick. She's also in medicine. Our friends are in medicine. And we quickly hit the limitations of medicine, which we didn't know existed. And through that journey, I went back, as I said, this is the shortest version, but I went back to school, got certified in functional medicine and then integrative medicine. I got my PhD in that and have really learned that while conventional medicine is an amazing tool, it is only one tool. And to achieve true health, you need more than one tool.
You focus a lot in your discussions about medical gaslighting. Is that correct? With patient care?
So the second part of your question there, I apologize for not picking up on it, was what am I building? So I'm building a community now for people, primarily women, but there's room for everyone, primarily women who are experiencing medical gaslighting. But this community is for the well-versed person, someone who is science-based, who is not anti-medicine or anti-conventional medicine, but is still somewhat skeptical and has some questions and needs more and doesn't know where to turn, but does not want to be in the extreme world. And so that is where the community is. The community takes the best tools possible, validates them, and brings them here.
What's like an example when you work with the patient to empower them? What does that process look like?
So I don't work with patients one-on-one anymore. I mean, in my primary conventional practice I do, but I don't work with patients one-on-one anymore in the functional space. What I do now is speak on stages and provide educational videos. And I'm working on my second book. But an example would be, we could talk more about this, but when someone feels gaslit, ultimately the question is, what can you do about it to the patient? You can't change doctors. You can't change the system. So what are you bringing to the table that is actually enhancing this gaslighting? So that once we talk and shift, not the blame, but some of the agency and the ownership onto the patient and give them the tools, they can actually never experience medical gaslighting again.
Wow, that must be an amazing transition once they go through that. Is that some of the feedback you're getting, or what does that transformation look like?
Yeah, so the transformation looks like, so let's first define what gaslighting looks like, feels like, and then, right? So gaslighting by definition, it's a bit of a misnomer because true gaslighting is there's malice in there. Like the term gaslighting comes from a play where somebody purposely created a different reality to drive their partner crazy. So there's malice in gaslighting, but we use it more colloquially. And I think everyone kind of knows that feeling where you're trying to make me feel like it's all in my head. I don't think there's malice in there. I think there's perhaps a certain percentage of doctors that are just unworthy. So let's just put those on the corner. But most doctors, NPs, PAs do not do all the schooling just to gaslight. So I think what happens with doctors or providers is that they go in with the best of intentions, giving everything in their tool set, not recognizing that there's more. So if I say to you, listen, Susie, I've done all the blood work and I've done all the images and everything is normal. There's nothing more I could do for you. Maybe you're just anxious. The patient is going to feel very gaslit, like, I'm not anxious. I really am short of breath and fatigued, XYZ. But the doctor is genuinely saying with all their heart, there's nothing wrong with you. And so there's disconnect is that area that feels like gaslighting. So what's a patient to do, right? So a patient's not going to be like, what are you going to do? Get louder, give them more, bring a bigger file. You can't change that. That person went to school for 11 years. And this is what they know. Their real limiting factor, they have a breadth of knowledge, but what they don't have is the understanding that what they know is just one tool. Our doctors are truly indoctrinated to think that their evidence-based medicine is the only thing that will help someone. And I used to be like that too. I'm a recovering gaslighter. So
I like that.
Thank you. So what's a patient to do? A patient has to say, they need to understand that their doctor is limited. So part one of the conversation is understanding that whatever you came to, that primary care, that GYN, that neuro, You came for one thing. You came to find out if there was a pathology. You came to find out if you're sick, you have cancer, you have a tumor. You don't. Amazing. But you still don't feel well. But they completed their job for you. They're there to work for you. They're there to cross out one line. And then you go and you find someone else. Part of this, there's a little bit more to it, but part of this is understanding that we have to change our expectations of our providers. They are not going to have all our answers. So they are there to give us their answers. And when they're done with their answers, that's amazing news. You found nothing. That's great. I don't have a tumor in my head. Amazing. And the conversation ends. We don't get frustrated with them. You would never get frustrated with a plumber for not being able to fix your electric.
Yeah.
You just wouldn't. You'd be like, great, thanks for fixing my toilet. Now I need to get electric. That's how you treat your doctors from now. Great. You found nothing? Amazing. Thanks. I'm going to go to my functional medicine person now. And not all functional medicine people are equal. Some functional medicine people are in mold, some are in Lyme, some are, right? So you need a team. And once you understand that you need a team, when you have a wedding, your DJ doesn't make the wedding cake. The cake person doesn't plan the music. Each person has their spot. And once you start treating your providers the way you would anyone else on a team, that already brings down the level of the gaslighting you experience. So going back to that first moment when she says, Susie, there's nothing wrong with you. All you need to hear is, Susie, I found nothing with my tests. Amazing. Thank you, Dr. Smith. Have a nice day. Move on. There's going to be a time you need Dr. Smith, so don't write her off. Like, you're going to need Dr. Smith. You might have a cold. You might have a broken arm. You need something. So she's in your medicine cabinet, but you don't need her right now. So that's part one. I don't know if you want me to keep going.
Yeah, keep going. I love it. Keep going.
Part two it was recognizing our role as patients in the relationship of gaslighting. It takes two to gaslight, right? Someone is doing the gaslighting and someone's standing for it.
Yeah.
Right. And in every relationship that you have, if you've been in therapy ever, the therapist will always tell you, you can't change your partner. You can only change yourself, right? That's it. So standard, right? Set your boundaries, right? So you have to understand, we are, as patients, have been indoctrinated since pediatrics. Doctor knows best. This is how you behave in the exam room. This is what you do. You make yourself small. You make yourself quick. You make yourself easy. So you're coming in to this relationship already less than. These are CEOs. These are women who are running PTAs. They're running 5 kids back and forth from soccer background. These are women that know what to do. But when they come into the exam room, the training of years of what it means to be a good patient just kicks in. And suddenly they don't know how to ask questions. They don't know how to ask, for clarifications. It all goes out the windows. You have to be prepared and kind of undo some of your own indoctrination when you come in. Now, again, it doesn't mean to get loud and it doesn't mean to get obnoxious. It means to not say, I'm so sorry for taking up your time. What are you talking about? When my patients say that to me, I'm like, what do you not? You came here, you sat in the waiting room. Exactly. This is your time.
Yeah.
I don't mean to be a pain, but what are you talking about? You came here, right? You came here for a service. So these are the type of things that we've learned to say when we come to exam rooms. So come differently. I'm saying these are my top 3 concerns. This is how I like to address them. What is the plan? Very different than, I have a list and I'm really sorry and I don't want to take up your time. So we have to also retrain ourselves. How are we showing up to the exam room?
Yeah, preparation, it sounds like, is a big part of your education as well, coming prepared and exactly the right verbiage as well in those meetings.
Yeah, coming prepared with your mindset and then coming prepared with the verbiage for sure. Do not come with your file of 4,000 charts.
Thanks, yeah.
Absolutely no one's looking at that. And you're setting yourself up to be disappointed if you think they're going to look at that. But you can come prepared and say, in a quick synopsis, this is what I've done this past year. This is I've already ruled out. I've already ruled out a brain tumor. I've already ruled out cancer. I've already ruled out blah, 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 blah. These are the tests that I've done. Here's the question that I'm left with. And if you're not the right person, who would you direct me to? Very different than, because remember, doctors only have X amount of time. They have a boss to answer to. So they have 15 minutes, 10 minutes. They are not going through your file. But if you give them a synopsis and ask them your questions in a pointed way, they will most likely be able to at least say, you know what, you're just in the wrong office. Here's who I recommend to go. So preparation is a big part of it.
You mentioned as well, like you were, like, I think you said a recovering gaslighter, I think was the term used. You might kind of like tell me how you started out that way and then when did you start transforming? Yeah.
For sure. again, without any malice, really taking care of all of my patients. If you would come in and you told me something was bothering you, I ran every test. I mean, I would sit up at night worried about my patients. And when everything came back normal, I'd be like, whew, amazing, everything's normal. And I would be the one to deliver that news like, Susie, everything's normal. And in reality, I did do everything for Susie. I did everything according to the protocol. If the protocol said headache, do this,
Follow the steps.
Followed all the steps, never realizing that Susie would leave the office disheartened because I'm delivering great news. There's nothing wrong with you. So I never realized that there was another piece to it. Again, there is a lot of brainwashing that happens in med school, MP school, that this is the only thing. Just like gold standard, evidence-based medicine. The verbiage is very much, it's not like, hey, this is what we know and there's another world. It's always like, this is it. Everything else is nonsense. So really, truly, without malice, took care of my patients in that way. But then my wife got sick. My wife developed 2 autoimmune issues. One is called PMLE, which is basically an allergy to the sun. And one was severe psoriasis, like extremely severe, like at the bottom of her feet. She couldn't walk. She couldn't button her shirts. It was very dramatic.
Sounds very painful.
It was very painful. And so we read the journals, and our friends are doctors, and I have access to any appointment I want in the world, basically. And so access was not an issue, and knowledge we thought was not an issue. And basically we understood that there was nothing to do. It's creams for flare-ups, avoiding the sun, altering your life, and living with it. And there was no suggestion otherwise. And there's no literature anywhere that would suggest otherwise. And so we did. We lived with it because we understood the science. And then I was in a group of, we was a shared space with a group of people who were a little bit more alternative thinking. And I just happened to share this story like over lunch. And they were like, oh my God, psoriasis. Yeah, that's so manageable with blah, 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 blah. And I'm like, what are you talking about? Now, this is pre-internet. And I'm like, what are you talking about? There was no Instagram. There was no, what is a microbiome? Nobody knew these words. This is absolute snake oil nonsense as far as I was. And they're like, yeah, you should really see this guy, this chiro. I'm like, chiro? My wife doesn't need an adjustment. He's like, no, he's a chiro, but he did this thing called functional medicine. I don't even know what you're talking about. They're like, no, you really should go meet him. And we had nothing to lose, right? Our life was already altered. And so I was like, let's just go. We'll lose some money, like at best. Let's just go hear this guy out. But really like this, like, okay, this is going to be nonsense.
I'll do it, but not super excited about it.
Yeah, almost to prove this guy wrong, and we were both healthy women, not overweight. We don't eat fast food. And he had the audacity to tell us that our nutrition was off. Like, what are you talking about? And the connection between nutrition and psoriasis, which for many of you now would be like, duh, but like years ago,
different. Yeah.
No one was talking about this. And then he did these tests we never heard of, these blood tests not covered by insurance. We never heard of them. We never really heard of these things. And lo and behold, my wife, who's a size 0 vegan, the epitome of health, was determined that corn, soy, and gluten were her enemies. And that was primarily her diet as a vegan at the time. It was corn, soy, and gluten. And so we changed it. And I want to say that within 24 hours, we already started seeing a difference. Not 5 months later. That quickly. We took pictures of her psoriasis because we couldn't believe what was happening. Like we kept saying, nah, it's got to be a mistake. Like it just must be a good day. It must be like, we just started watching the psoriasis disappear. And in a way, I'm glad we had psoriasis because you could visually see it improving.
See it happening. Yeah.
And then suddenly we noticed that we didn't have to run out of the sun as quickly because she would know if she was getting a flare. She wasn't getting flares. We stayed out longer and longer and longer. So both autoimmunes completely reversed. Never to be seen again. Never to be seen again. And I could say, though, if she like completely is off her nutrition for a while, it will come back. So this is really important because it's not curative. Because the right, it's all been there, but you can live as if cured. And that was it. Watching my wife go through that, understanding that there was something out there that we were never, ever taught, ever. Till this day, not taught in med school. I went back, I did a class, another class, another class. And then I went all in, and it changed the way I practiced, and it changed the way so even now when I practice primary care, I can't do functional medicine, but I can tell my patient, listen, here's the difference for any colleagues listening. Here's the only thing you need to do in the exam room. You don't have to get certified. You don't have to go for your PhD. When your patient says, I don't feel good, XYZ, and you do everything you need to do, instead of saying there's nothing wrong with you, you just need to say, Susie, I really believe you. But all the tests that I have, I couldn't find it. But that doesn't mean that what you're experiencing is not real. It only means that I don't have the answer. I will refer you to some specialists that I've met along the way. Maybe they have the answers, and I will be here to support you. What a different experience.
That's a huge difference. Yeah.
You're fine. Yeah. And that's all we need to do. Easier said than done, because most of my colleagues don't believe that this stuff works unless they get sick or their partners get sick.
Yeah, that's an amazing story. Have you heard anything similar to? I'm curious about that physician and that provider you first met, where you kind of learned all these new concepts. Is there like a genesis to all this for functional medicine? I'm kind of curious to hear more about the history of it, and I think the audience would be as well. As I'm just curious if you know more about how that all started in that space at all.
I don't know how it all started, but I don't know. I know that it all started only with people who are clinically trained. And that has become the criteria also to be on my podcast. The people who started it were all MDs. The people who, when you get certified, you must be clinically trained first. You cannot be like a health coach. You cannot just be an influencer and take a class. There is an assumption that you already understand the basic tenets of anatomy, physiology, and some medicine. And then they teach another layer on it. And what's important about functional medicine, and there are other modalities that are wonderful as well, but what's important about functional medicine is that it rests on everything we know from Western medicine. It's not an alternative. It's another layer. In fact, it's the first layer, because if you look at any protocol, high blood pressure, if you look it up on our phones for the protocol for high blood pressure, the very first sentence is going to be say lifestyle modification. When lifestyle modification fails, here's your medication. But in med school, we skip that first line. What the hell is lifestyle modification? Yeah, we just say, go low sodium. That's it. We don't talk about anything else. So it's already in the evidence-based medicine. It really, truly is. It's just that in med school, we skip that part and we understand the mechanism of actions for each medication, the pathophysiology, all very important, right? I would never tell somebody with high blood pressure, just get off your meds. But I can say, oh, hey, if we spend some time here, maybe we can slowly get you off your meds or prevent it if it's early on. Functional medicine really understands that it's really based on, to pass the test, the biochemistry that we had to, like, it is intense. It's understanding, it's not like, hey, take a vitamin. It's understanding where the vitamin is used as a cofactor in a reaction to detoxify or whatever. So it is a amazing science-based, evidence-based way to manage health.
Yeah, and it kind of looks, speaking more to the industry too, like what's one conversation happening quietly right now that deserves a lot more attention that maybe people are not talking about? Is there anything that comes to mind?
I think what comes to mind is kind of the core of the community I'm trying to build, which is health, like everything else, has become really siloed. And because it's become siloed, the people who are really science literate but have questions, they have no space, right? So let's just say, for example, you are, again, well-versed, you go to your doctors every year. You are not the people who reject conventional medicine. Go every year, you get everyone vaccinated, everything's wonderful, and your kid now has a reaction to vaccines. You're not anti-doctor. You're not anti-pediatrics, but you need a place to ask your vaccine question because something really happened to your kid or to you. You took a COVID shot and for 4 days, I have patients, 4 days, you couldn't move your arm. Really scary. So, but where do you go? You have no space, because if you go to the anti-vax world, well, it's not your world. You're not anti-vax. In fact, you really believe in the science. And so I think because of social media, which I do love because it's a great space for information, but you have to pick a side on health. And it's absurd because there's so much good on both sides. And there has to be space in the middle. But soon, even now, I'm scared. I said something about vaccine. Is YouTube going to shut us down? What's going to happen? Because it associates me immediately with the side that's very anti, and I'm not in that side. I'm in the side that says, there are people who are vaccine injured, and we should spend some time and resources to see who are the ones and what can we do to help minimize that, and whether it's spacing or whatever. But there is no space for that conversation. Or even for the conversation, let's not even go that extreme. The conversation for the woman who's perimenopausal, postmenopausal. She is, going through these changes, going to her doctor, everything's like, yeah, it's fine. You just have to go through these changes. But there is a whole world of hormones that is really strongly evidence-based medicine. where does she go with these questions? So because of this silo, we've forced people into extremes. But I don't think everyone's really as extreme as their social media algorithms are.
Yeah, it's very polarized.
It's very polarized. So I try to create the space in the middle so I'm trying to be like, I'm not saying that anyone who is not clinically trained has no worth, but I had to draw a line in the sand. My people are first clinically trained, and then like me, had a transformation where they brought more in. So there's like this balance of being in both worlds. And I think that speaks to this non-extreme community.
Yeah, there's definitely a fine line balance that you're trying to work between the two worlds, it sounds like, as well.
Yeah.
Another question I have too is like, what's the uncomfortable truth about your industry that nobody wants to say out loud?
About my industry that no one wants to say out loud. The uncomfortable truth. Wow, I don't know, because I feel like everyone is saying everything out loud these days.
Yeah.
Everyone was saying everything
That's a
out
great
loud.
statement. Everyone is saying everything out loud these days. That's true.
Yeah. I mean, I don't know how to answer that because everyone's saying this out loud. I guess I wish I'm just gonna reframe it into like what I wish. I wish what we could say more out loud maybe is I wish there was a space in the world of my indoctrinated brethren and sisters who are like neck deep in Western medicine. I wish that they could see that there is more out there and to not group it all with some of the crazy shit that's out there.
Yeah. The bad stuff or whatever they classify that as.
Yeah, because I watch my colleagues on socials really put down this alternative world. And what that does again is silence the people who have questions. So yeah, it's scary.
Yeah, it is scary. Then is there specific examples in your mind that you're thinking of when you made those comments, or like stories or things that have happened in the past that you can dive deeper into?
You mean with which part?
The providers and your counterparts, your colleagues.
Yeah.
Just curious about what they're saying.
Sure. So the providers will just, anything that comes out. The Tylenol thing came out, right? So
yeah, that's a recent one. Yeah.
The providers will just be like, if you think it causes autism, basically you're stupid, right? And so like there's this binary, like the doctors are all aligned. Like anyone who thinks this is absolutely dumb. And then you have the people on the other side who are like, anyone who takes Tylenol is crazy. And I actually did a reel on this and I said, listen, if you've already made up your mind on this topic, great. I'm not talking to you because I can't help you. But there is a lot of us here in the middle right now who are just not sure. And then I said there's a time 10 years ago, if someone came to me and said they were pregnant, I'd be like, take some Tylenol. That's the safer option. Now I would say, you know what? If you just have a headache, maybe hang tight with it. But if you had like severe fever, I'd be like, okay, let's do that, like as an infection. So there's a world now where can we have a conversation about my concerns without you calling me an idiot for not thinking it or an idiot for taking it? Like, can I have a space to do it? So yeah, I see this every time something comes to light. Both sides will basically call the other side dumb. And this side is primarily uneducated. So when they do it, okay. But this side is very educated and they're doing the same thing, And then at the same time, these guys are closed-minded and you're supposed to be open-minded, but you're just as closed-minded. Like if anyone says, no, I think I do want to take Tylenol because maybe Advil really hurts my stomach and I'm worried about a GI upset and sometimes I really need something, then this side is also going to be closed-minded about it. So every single topic in health has become so binary. And of course, it doesn't help that it's also, because of MAHA, has become politicized. And I'm not a MAHA advocate in general in terms of politics. I think anyone who looks at me can kind of know where I stand politically. But so much of what they're saying health-wise and science-wise is so on point. But if you align with anything that they say, then you've crossed, so it's just like this crazy area where you're not, both sides are not listening to sound evidence. And it's a horrible place to be.
Yeah, they're acting off of emotion and not really logically thinking through it or even having any empathy. Lack empathy is a big issue right now.
For both sides. Both sides are more busy being right than actually caring about what's happening to people.
Yeah. Yeah. And social media and media in general usually doesn't help. It kind of amplifies things or like focuses on one part of it. But I think you bring an interesting point here is like it's happening on both sides, not just one or the other, in that there's this new unique space, which I don't think is talked about in the middle, where people are not sure, they don't know where to go. They have no idea.
No idea where to go.
but they're afraid to, they may be afraid because they're like, well, I have to pick a side, like you said, but they don't want to do that. They just want to be
Yeah.
like right there.
Yeah.
They don't want to pick a side.
Exactly right. You don't have to pick a side. So that's what we're trying to do. You know, you don't have to pick a side. Just come here.
Yeah.
When
And,
it comes to health, you don't have to pick a side.
Exactly. And this is another kind of random question, like what's a challenge that keeps you up at night, but might not look urgent from the outside?
What's a challenge that keeps me up at night that might not look urgent? Like on this topic, because me personally, what keeps me up at night is finishing my book in time for my publishing deadline. But I would say this siloing is very difficult for me because socially, no matter where I am, everyone is so buried in a silo and not recognizing that they're in a silo. All my close friends, and I have friends on both sides of the aisle, they don't recognize that they're in a silo. And it's terrifying how fervently they believe their reality.
Right.
And maybe it's because I have friends on both sides and I could hear a topic discussed with equal passion. And both sides thinking the other side's a villain. It is really concerning because I don't see a place, right? And this is also done purposefully for the power. Like, there's no question that dividing a population is so much easier to manage. But seeing it daily is very troubling because it's only gets worse day by day by day. And I don't see a place of unification. And that hurts my soul.
Yeah, it hurts. It probably like hurts your heart in a way because you want to see a solution being worked on and focus on the solution, not the person, right?
I would like for people to be able to just have a conversation. Yeah. Without fear of being associated with something.
Correct. Yeah. And respectful conversation, I'm sure, is like the most obvious thing, but doesn't happen, right? It's more of the attacks that occur, unfortunately.
Yeah, exactly right.
And another question I have, this is more like your vision, kind of where you're looking at right now. So imagine your boldest idea actually worked. How would that change the way you show up in the world, or even the groups that you're focused on?
My boldest idea is that my community becomes a space where millions of people come. I would love to build out my website for it to be a place to find data from all sources so you can ask your questions, and that we develop and strengthen this community. It's hard because the middle is always hard. It's very easy, right? Every time we do marketing, pick a niche, be polarizing, say something that agitates. Like that's how you get big. So this is the longer road. The middle of the road is the longer road. It would be nice to see, but I know the majority of the people live here. The majority of the people are here. And so my boldest idea was that we're unified on health topics. We don't have to be unified on everything. And where we understand that it's all the world of yes and. Like, yes, I need my primary and my acupuncturist. Yes, I need my cardiologist and my functional medicine person. That would just be a great place to live.
Yeah. And I think you're speaking to like they're different worlds, right? Unfortunately, right now, they're just completely different, how they work together and maybe even see each other, unfortunately, as a team, right?
Yeah, exactly. That's a good question. I like that question.
And there's another question. So if you had a magic wand to fix one thing right now, what would it be?
The silos of social media. I would lift the veil off of everyone's eyes so they could see what's actually happening. That is the tragedy of this generation.
And how have you seen that transform over time? Because I know you kind of started back, like you said, pre-internet era with this discussion, and up to now, like how has it changed over time?
I mean, listen, I'm old, right? So the internet at first was a place for information. It was really just a place for information. And then it got to be a place of like ads. That was its own trouble. Like every time you ask a question, you're going to get sold something. But now it's just used to divide people. And I've been through enough marketing agencies. They all want you to be polarizing. And so people are. I don't even know if sometimes people who are saying things even believe it, because you just want the views and the likes and the subscribers. So yeah, it has just changed. It's just changed into like a new form of tribal warfare.
Yeah, I like that description. It's it gets more and more polarized, and I kind of look at it as like I don't know if it's a funnel is the best way to describe it, but like it started off, like you said, very narrow. Like I want to search for something, and then growing out to this big, wide range of things where everyone is divided and in their own little world. It's okay to have a different viewpoint. You don't have to agree with them, but you need to listen and empathize and see where they're coming from. I think that's a big missing piece of the puzzle.
Yeah, exactly right.
Yeah.
I would just want anyone who's listening here to know that if you're experiencing medical gaslighting, take a moment, take a breath, listen to your inner voice. If you need more answers, then you need more answers. Do not suppress your inner voice because of whatever experience you just had with any provider. Be thankful for that experience. I'm sure you've learned something, and just move on and keep adding more and more people to your toolbox until you get what you need.
And where can people find you? Where can they connect and learn more about yourself and what you're working on?
So it's just my name, Dr. Efrat LaMandre. I'm sure you'll link it. And then my podcast is called The Medical Disruptor. So just come hang out. I will never sell your email address. And I also am not going to sell you stuff. Maybe my book one day. That's it.
Thank you for your time. It was wonderful. Thank you.
Thank you.